Welcome back to This is Van Color. You may have heard of the government of British Columbia introducing new rules around the sale of nicotine pouches such as ZYN and ZYN. These increasingly popular products will now be put behind the counters of pharmacies in order to be out of reach for minors. But social media influencers, including Tucker Carlson, say that nicotine pouches are not only safe, but good for you. More moderate voices don't go that far, but they say that nicotine pouches as a form of harm reduction can be an effective way to quit smoking. Here to give us his scientific insights is our featured guest, a researcher, public health physician, and Vancouver Coastal Health Medical Health Officer, Dr. Michael Schwandt. And this conversation is supported by Shelter Point Single Malt Whiskey, distinctly Vancouver Island, uniquely Shelter Point. So Dr. Schwandt, I'm on TikTok, and a lot of these influencers are saying that nicotine pouches, particularly ZYN, are good for you. So before we get into the nicotine pouches, let's talk about nicotine itself. I've heard that it increases cognitive ability. I've heard that it boosts testosterone. So is nicotine by itself actually good for you?
We don't have a lot of great evidence for these claims. This is something that continues to be researched. What is known about nicotine very closely is it can be extremely addictive. So we see that rapidly, and even with pretty small doses, that people can become physically dependent on nicotine, and they can have long-term addictions related to that. And that can come with withdrawal symptoms too. So headaches or even changes in mood when we withdraw from a substance like that.
Interesting. And is that because nicotine basically gives you a dopamine hit? And so when you're addicted to something, the things that give you pleasure or dopamine actually start to narrow?
Well, you've nailed it. It's really closely tied to what we call the reward circuits in terms of our neurology. So this is a behavior that's extremely rewarding for the brain, for our experience, but also when it's withdrawn can come with its challenges.
Okay, so now let's talk about nicotine pouches. Can you explain what exactly they are? Because it's not chewing tobacco. It's something that's actually quite new, right?
Yeah, this could really be described as a nicotine delivery system. So in these pouches, we have synthetic nicotine. This is not tobacco leaves, but just nicotine powder usually within a small pouch. And this can be held between the gums and the upper lip or the cheek. So you will have this constant delivery of nicotine right into the bloodstream.
Okay.
And many of these come with different flavors. So you'll see some of them marketed under flavor names like Chill Mint or Cool Breeze, things like that. So they're meant to be a pleasurable experience as well as delivering nicotine.
Right. And I feel like those flavors mean that it's targeting kids, right?
Yeah. It's challenging to say exactly what the intent of this marketing is, but we know that the effect of it from the recent history with vaping is that some of these flavored products, the way that they're positioned in retail and other factors like that, can have an effect of impacting on reach to children and youth.
Okay, so again, going back to TikTok, I'm seeing all these influencers and including some notable public personalities like Tucker Carlson talk about how great these nicotine pouches are because of those reasons that I gave you, that they spur cognitive ability or whatever else. And they say that it doesn't come with the harms of smoking or even vaping. So what are the health risks associated with nicotine pouches such as ZYN or ZYN?
Yeah, and it's a really important point that's made there that most of the health harms from smoking cigarettes come from the combustion of tobacco. So lung cancer, heart disease, respiratory conditions, things that affect the lungs. We know that that's really from burning cigarettes and inhaling those heated vapors. So there is I think the realistic assertion that some of these other nicotine products can avoid some of those harms. But in the meantime, we know, especially for youth, that nicotine exposure can have impacts on the developing brain.
Oh, okay.
It can lead, in some cases, to difficulty concentrating, difficulty with memories. This is very important during learning, of course.
Right.
And having that effect, as well as I'd mentioned, on physical dependence and withdrawal can be very impactful for young people because if they're experiencing headaches, dizziness, low mood when withdrawing from nicotine, this can be very challenging.
But I'm an adult, so it's probably good for me, right? Or at least safe.
Well, I think that most of the impacts that have been described, I think, involve the local irritation that can occur. So sometimes it could be described as relatively minor compared to smoking cigarettes. So irritation of the gums, of the inside of the mouth, in short. Longer term research hasn't really been done because these are close to brand new products. We know that tobacco products do have impacts in terms of cancers of the mouth and throat, but these newer products aren't as well characterized. So we just don't really know what the longer term effects will be.
Interesting. Now, one thing I've heard is that these nicotine pouches often have aspartame in them. So the way you're absorbing them through your gums, it's not actually being digested through the normal system, which means that we don't actually know what the results may be of consuming aspartame in that regard. Is that a fair concern?
Yeah, it's a good point that these new products, these new delivery modes for nicotine just aren't really well studied in terms of the potential health impacts. They're relatively new products, so we just don't know those longer term impacts. We do know that a big part of their design is just that rapid delivery of nicotine, because of course these products, when they have that rapid onset of the nicotine in the system, can have that reward, as we mentioned, and that addictive effect.
Now, in broad strokes, how would you characterize the health risks associated with smoking cigarettes, vaping, and then these nicotine pouches?
Oh, I would say quite clearly, smoking by far is going to be the most impactful. Okay. So you're going to have that whole suite of health impacts that are really well known at this point. Multiple different forms of cancer, impacts chronic obstructive pulmonary disease, higher rate of heart disease. So many different
which we've known for decades,
which we've known for a long time. And a lot of that is, again, specific to the burning, the combustion of tobacco and some of the additives that are in cigarettes. So a lot of that is going to be avoided by other nicotine delivery systems, but that key element, that risk of physical dependence and of addiction remains, because this is an addictive substance.
Do we know the health risks associated with vaping as well? Because some people see that as a safer alternative to smoking cigarettes.
Yeah, and I would say that vaping is definitely going to be lower risk than smoking cigarettes. I think this has been something we have some years of experience with right now. But again, when you're looking at that really superheated substances, inhaling that directly, it's not without health impacts. We have seen descriptions of injury to the airways, injury to the lungs in some cases. So it's not without risk, but I think we need to be candid that this is safer than smoking cigarettes.
Now, when it comes to the ban here in BC, I shouldn't call it a ban, but a restriction in terms of the point of sale of ZYN and ZYN and these nicotine pouches, there are a lot of people that say, hey, these nicotine pouches are actually great harm reduction tools for people to quit smoking. Yeah. So the idea is, just like you would use Nicorette gum, instead of smoking, you would now use these pouches, and then ideally, transition off of those. Yeah. Is there a role for nicotine pouches in terms of harm reduction or being able to quit smoking, which, as you just said, has higher risks?
Yeah. And these products like ZYN have been approved as natural health products by Health Canada. They're in an interesting...
Natural sounds all good.
Right? They're in an interesting space because they have a low amount of nicotine relative to cigarettes or vaping products. They're not inhaled, so they're not captured by the tobacco and vaping regulations that manage where we can buy tobacco, vaping products, where those can be sold, I should say. The issue right now is managing in a balanced way where these nicotine pouches can be accessed. So for adults who might choose to use those as they have been approved for reducing or quitting cigarette smoking, they can be accessed. They're right now behind the counter in pharmacies, so you need to interact with a pharmacist to get them, rather than on the shelves of convenience stores. Right. We had early observation, and this is the case in most provinces of Canada right now, that these are in convenience stores, gas stations, potentially between the chocolate bars and the chips. And as you might have seen, they are basically in containers that look more or less like a tin of mints or gum.
Right, yeah.
So the idea is that they should not be in spaces where young people who are not using them, in many cases, to quit smoking, but using it as their first and only exposure to nicotine, potentially, restricting that access while still allowing adults to use it for the purpose for which it's been licensed.
Can minors still buy nicotine pouches if they go to their local pharmacy and talk to a pharmacist?
Yeah, it's an important point. In BC, the regulation allows minors to. They need to talk to a pharmacist about why. So a pharmacist would ask, as they would for some other products that are behind the counter, what do you need this for? What's your intended use? So realistically, some minors are trying to get off of cigarettes, and we would applaud that. And so if this is a product that works for them, that's something that they could access, but it would involve the interaction with the pharmacist, with their judgment, their expertise, and create a pretty fair amount of friction, if we're honest, between a potential recreational user and the product, while allowing somebody to use it for the purpose that it's been licensed for.
So in conclusion, what I'm hearing is nicotine pouches may be a great tool for quitting smoking, but you definitely don't want to just start consuming nicotine by taking these nicotine pouches.
Yeah, I think that the evidence for these as potential quitting tools is still coming in. I think that we'll see how these go over time. We know, unfortunately, from vaping that hundreds of thousands of Canadians now use vaping as their first and only exposure to nicotine products.
Yeah,
So they've started to vape
yeah.
rather than using it as a quitting tool. It's their now a product of habitual use. So definitely we would not recommend that adults or children and youth should begin to use these products recreationally. Extremely addictive, and the harms are at this point still unknown.
Fascinating. Dr. Schwandt, thank you so much for clearing up all the TikTok pseudoscience that I've learned. I appreciate your time tonight.
It's a pleasure, Mo.
Absolutely. Folks, that was Vancouver Coastal Health Medical Health Officer, Dr. Michael Schwandt. Thank you to Shelter Point Single Malt Whiskey for supporting local conversations. Now, after a little business, are protests getting too toxic? I have some thoughts up next.